And India has shown a dramatic improvement in its air and water quality since the start of the lockdown as well. This clean environment is having a direct impact, reducing asthma, reducing allergy cases as well. Hospitals have even seen a drop in terms of footfalls in the heart patients, but there's a reason why. Here's a look at the report coming in.
A country of 1.3 billion grinds to a halt. India has shown dramatic improvement in its air and river water since the start of the lockdown. But the jury is still out if the restrictions have signaled similar improvement in heart disease because of dramatic environmental changes. The country's top medical experts agree that the lockdown has reduced footfalls of heart patients to hospitals. But that shouldn't be seen as a sign of decline in heart conditions.
20% of the patients come from road traffic accidents or trauma. Now, as you know, the roads are empty, so that 20% is not there, and it's a good thing that they are not there. But we are still getting at least 60–70% of the patients are still coming. And in a hospital like ours, which is a super specialty, we get all the emergencies, heart attacks, the intestinal obstructions, the cancer patients, so and people who are in crisis with any other infection. So we get enough patients right now, but they are of a different variety, which is, say, if we were treating 150 patients a day in our emergency room, today it will be around 70–80.
A leading cardiologist, Dr. Sameer Gupta, feels most heart patients could just be taking local care or self-medication because of restrictions. Some others might be avoiding hospital visits for fears of catching coronavirus infection.
The number of patients with heart disease coming to the hospital has gone down in terms of number for sure when you compare it, over the last 10 days compared to what it was a year or 2 years ago. And if that is just because, and it's probably because of the lockdown, because it's difficult to commute. I think people are just scared of coming to the hospital. There's an inherent fear that, if I go out and I venture into a hospital, it's a place where sick people come. Can I catch the virus? Can I try and avoid going to the hospital for as long as possible? I'm not sure if the actual number of heart attacks have gone down that drastically as it is reflected in the number of patients who are actually showing up to the hospital.
Medical experts agree that a cleaner environment from lockdown has provided temporary remedy to several other respiratory illnesses.
People with respiratory complaints and with cardiac problem are doing better, and their breathing is much more comfortable, and requirement of medication, especially inhalers in our patients with asthma and bronchitis, is down.
Hospitals such as AIIMS have launched special helplines to reach out to regular patients via teleconferencing, a step in the right direction there, as people suffering from non-communicable diseases might just need as much medical attention during these tough times. Bureau Report, India Today.